Hi guys, I'm glad you're back to see me again. So today we're gonna change gears a little bit and be a little more technical and specific about certain things about your heart. Basically, I want to tell you about a great calculator that you can use. We use it all the times in our practice, but I think it'll be very nice for you all to do this. It's a little calculator. It's called ASCVD risk calculator. You can easily Google search it and plug in those numbers and see what you get. It's just a nice way to know what your risk of having a heart attack or stroke or any major event like that in the next 10 years. So once you see that risk, it's kind of an eye-opener and actually makes you curious to change some habits, or if you need to be on some certain medication, it'll help you guide that. So it's just a good way of knowing. It's not a diagnostic tool, but you can do it on your own. And once you get that score, if it gives you a low, medium, and high risk. So if you fall into medium or high risk, you should definitely speak with your physician or cardiologist, whoever you want to follow with. If it's a low score, continue to do what you're doing, healthy eating, exercising, etc. But it's just a good score to play with, so have some fun with it. I'll put the name in the caption. It's called ASCVD risk calculator. You can easily find it, and it will ask you, I'll tell you what it will ask you for. It'll ask you for your age. Okay, so I hope you all know this. Make sure you put your right age, guys, okay? Then I'll ask you for your gender, your race, cholesterol level, so make sure you guys have that handy. And if you have never had cholesterol level checked, I think this will give you a prompt to go back and get your cholesterol levels checked. And by the way, guys, you should check these once a year at least. Then I'll ask you to plug in your blood pressure. So if you have not ever done this, this is a good reminder to at least check your blood pressure. It will ask you whether you smoke or not, and if you have diabetes. So these are all the risk factors for heart disease, and you plug in those numbers and it comes up with a risk of like less than 5%. Is it 10%? Is it 20%? Anything less than 5% is low risk. If it's about 10%, it's medium risk. 20% and more is a high risk of having a heart attack or stroke or major events like that in the next 10 years. So have some fun with this. I'll put the name in the caption again so you guys can search it up and you can easily do it. All right, so do that today, okay? And keep moving. Bye, I'll see you later.